Dr. Sharfstein, it is good news, whether it is the thousands assembled in Los Angeles and Kansas City for football or in the walk-up I live in the lobby, everybody has to wear a mask. There seem to be great polarities. Here's the reality. We see cases rolling over nicely. We see hospitalizations rolling over somewhat. We're waiting for deaths to roll over. When deaths roll over, how will public policy change?
Well, I think public policy is changing in places where the cases are coming down and the hospitalizations are coming down now. So I think it's going to be a regional phenomenon. And then I think, to your point, I think the national mood will really start to change as deaths come much further down. And this is approaching the moment, where we are going to see COVID start to fade a little bit more into the background. I don't think we'll have nearly as much disruption in our lives in 2022, barring the emergence of something that we haven't anticipated, which of course could still happen.
The vaccine rate, I'm going to call amateur and Omicron, from 60 or 61 out to 64%. How critical is it to double that out to a 68% statistic?
Sorry, that is what statistic?
The vaccine rate was 61%. It's now 64%, according to most of the media reports I see. How critical is it to double that out to 68%? Does that mean something?
With every increase in vaccination, we're going to get fewer hospitalizations and fewer deaths. The value of vaccination again proved itself during the Omicron wave. So we have tools to protect ourselves, and we have to keep going. So just because it's going to fade into the background in our lives, the more we are smart about, protecting ourselves, preparing, the more it'll fade into our lives. It's not just by ignoring it altogether that we get that benefit.
Dr. Sharfstein, meanwhile, that's the U.S. and that's Europe, perhaps. Over in China, they've been trying to pursue a zero COVID policy, and we do have the Olympics starting on Friday. Hong Kong is experiencing a pretty big upsurge in Omicron, and one professor at the University of Hong Kong who has researched Omicron said the horse has bolted, and I don't think that the government is going to be able to get on top of this. What's the trajectory of COVID cases that you expect over in China, given the lack of social immunity built up by natural infection and just a normal life?
Well, it's the lack of immunity in part because the vaccines they've used have not been the strongest vaccines. And so they are vulnerable to COVID. There's no question about it. And this virus and some of the Omicron variants we're seeing are crazy contagious. So that's not a situation that's very good. And the idea of persisting in zero COVID without the benefit of better vaccines is a real challenge for China. And, I don't know. It's hard to believe that they could make it through with so many people coming in without it getting out. Of course, they have tools and approaches that we would find unacceptable in this country to accomplish that. So I don't know what's going to happen.
Those tools that we would consider unacceptable, are they even enough, though, to stave off the upsurge in likely Omicron cases and likely COVID cases after the Olympics? Can you game out what it might look like in the weeks following?
Well, if the Omicron gets out into the Chinese population, it's likely to spread very quickly, given the fact that the vaccines used there are not as effective. And then we'll have to see the scale of the reaction from the Chinese authorities. I don't know what's going to happen. I'm not someone who's going to be able to put together a scenario between the biology and the politics, but I don't think it's going to be, very pleasant for people in China if they go for a zero COVID approach in the setting of such an incredibly infectious variant. So, on the other hand, they may, have to do some pretty significant actions to avoid so many people getting very sick.